The purpose of this video is to help prepare you for virtual rehabilitation, also called Telerehab, particularly if you are going to be moving around your environment. Here are some tips to help get you and your space Telerehab ready. The first step is to get yourself ready. Choose clothes that are loose and allow you to move comfortably. Choose footwear that give your feet and ankles lots of support and good grip. Wear any ankle splints or orthotics that you would normally wear when standing or walking. Before the start of your session, make sure you have all of the equipment that you need. This might include a water bottle, pen and paper, and any exercise equipment. Make sure that the device you are using is charged and ready to go. This is also a good time to prepare any questions you might have for your therapist, or any homework from a previous therapy session. If you use a wheelchair or walking aid, ensure that they are close by and that the brakes are on. Next, let's get your environment ready. If you can, choose a quiet and private space that is free of noise and distraction. If you have pets, they should be in a different room. Choose a space that is well lit, but avoid having a window behind you to prevent backlighting. Declutter your space. Move any obstacles or tripping hazards out of the way. Ideally, the floor should be a firm, stable surface, such as a hardwood floor, and free of any area rugs. When performing exercises in standing, it is important that you have access to a secure surface in case you become unsteady and quickly need support. There are a number of ways to do this, and you should talk to your therapist about the best option for you based on your balance abilities and the activities that are planned. Here are some possibilities. Exercise close to a secure surface such as the railing at the bottom of your stairs. If you position a chair on one or both sides, it can be used for support, but only if the chair is sturdy and won't tip over if you grab it. Alternatively, you may want to use a kitchen counter or sturdy dining table, which offers the added bonus of support as you move from side to side or in different directions. For some people, exercising in a corner of their room is helpful, as it offers support on all sides, including behind you. If you have a weaker arm or hand, orient yourself so that your stronger arm is closest to the supportive surface. If you are moving from side to side or weight shifting towards your weaker side, face the support surface so it is always within arm's reach. And finally, let's get your camera ready. It is helpful for your therapist to see your full body. Once you find your optimal spot, mark both the camera location and your start position, perhaps with a piece of tape. Ideally, even as you move within your environment, you should stay in view of the camera as much as possible, so that your therapist can still see you. Your therapist may ask you to set up in different spaces within your home, such as in your bedroom or kitchen. And even outdoors. If available, a helper can hold the camera and walk alongside you. Here are a few additional safety tips. Regardless of your setup, keep a chair close by or behind you so that you can rest if you need to. Keep your phone within arm's reach or on your person, and have an emergency plan in place. We cover this in detail in another video. Before you start your Telerehab session, be sure to tell your healthcare provider about any concerns that you may have. Let them know if you've had any injuries, illnesses, falls, or close calls, as well as any unexpected visits to the doctor, or any other information that would be important before you start your exercise session. At the end of your session, make sure you let your therapist know if you are experiencing any new symptoms or feel overly fatigued such that you are worried about your safety or ability to continue with the rest of your daily activities. At all times, please remember that it is sometimes difficult for your therapist to know how you are feeling when viewing you over a computer screen. Be sure and speak up and let your healthcare professional know how you are doing. For example, if you are feeling particularly fatigued, weak, unsteady, or experiencing any pain or dizziness, or if you have any other concerning symptoms while exercising. Thanks for watching. We hope that this video has been helpful in getting you Telerehab ready.